my name's there on screen, but actually Carl Andrews is here too, and they're the main project research officer. So Carl and I will tag team a bit during the presentation. And I'll basically be talking about the work we've been doing in the last 3 years at Melbourne Uni on LGBTI homelessness, a number of different projects that we've been running to develop more knowledge about this area, and particularly to develop policy reform and service delivery training to the sector. So hopefully this will be helpful for everyone. So I'm going to do, a little bit about the drivers. That was one of the main reasons that we started this work. We have known for a long time that LGBTI people are overrepresented in homeless groups in Australia, but not really that certain about the drivers of the homelessness. So we did quite a bit of work on that. And then we'll focus a bit on service delivery and how services could be more inclusive, and a little bit at the end about systemic reforms.
Great.
So we have this data already from the General Social Survey, and it's a pretty stark graph, I think, just showing the number of people who have been homeless ever in their lives based on their sexual identity. So you can see a major difference between the bi-lesbian and het, Unfortunately, this study doesn't ask about gender identity, so we don't know about the trans or gender diverse people, nor intersex. But at least we have some stats on sexual identity. And that's a pretty big study, so it's pretty reliable, we hope.
Great.
So that's a start, just to keep that in mind. There's also been quite a lot of work internationally, particularly in the US and Canada and the UK, around LGBTQ homelessness. Not so much intersex, that hasn't really featured at all in international research at the moment. So unfortunately, most of what we'll talk about will exclude intersex populations, and that's something we need to address urgently. But anyway, you can see here that in the US, particularly youth homelessness, there's a really big overrepresentation. They say up to 40% of homeless youth are LGBT, compared to 7% in the general population.
Wow.
That's a huge difference. And then in Canada, a little bit more detail, and particularly they've done some transgender diverse statistics as well. So you can see, if you look at gender differences on the right, the trans and non-binary people, about 4% of the youth homeless population. So that it's showing this same increase that we see in the Australian General Social Survey. And we went into this work knowing that the structural drivers are the main difference, really, or we expected that in Australia. So the issue of discrimination, homophobia, transphobia, maybe biphobia as well, driving homelessness, particularly for young people. And this is a quotation from a big report that was produced in Canada a couple of years ago. And then, some work out of the States, again, has talked about the connecting issues for young people who are homeless and sexual minority. And this is across, and probably flows from the discrimination, so higher rates of mental health problems, drug use, sexual health risks, and particularly victimisation. And that all appears more like for people who are LGBT compared with heterosexuals who are homeless. So, we've got that as a background. Cal did a look at the literature that's not about young people, and there's very little out there. So it's just a reminder that we were interested in the whole age spectrum, not just young people. This is a big issue for some older populations and subgroups, and particularly trans people. So these are the project team. So it's Carl on the left, Deb Dempsey, myself, and Sharon Parkinson. So we formed a team collaborating with Deb and Sharon at Swinburne University of Technology because they've been doing a lot of work on homelessness generally. And so we built their homelessness expertise and our LGBT expertise to try and build this knowledge. So these are the 4 main projects that we've been working on, and we'll present some of the data from each one. So the first one was gathering information on the drivers, and that's both interviews with LGBT people who've experienced homelessness and also a range of service providers in the homelessness sector about their experience of seeing LGBT people. We did hope to interview people with intersex variations, but weren't able to recruit anyone. And also when we were talking to the homelessness services, none of them were aware of any intersex people in their services. So at that point, we had to say, well, we're still interested, but we haven't gathered that data yet. Arising from that, then we did a pilot of trans and gender diverse inclusive practice in one homelessness service in Melbourne, the Launch Housing. And we'll present a bit about what we found there. And then currently we're doing 2 projects. We're piloting a safe housing network in Victoria. So we'll explain that a little bit more near the end. And Carl's working on developing some best practice guidelines for the sector. Do you want to say anything more about the best practice guidelines, Carl, at this point? Or at least who's involved?
The people involved? Yeah, with all of our projects, we try and have quite diverse community and advisory reference groups. So with the best practice guidelines, for instance, there's 2 reference groups there. One includes experts from the mainstream housing and homelessness sectors across different states and territories. And the other group includes a range of LGBTIQ community experts. So it's been really great to sort of bring all those different perspectives together. Happy to chat more about that later. They're quite big groups for that project. But we're often working with a range of stakeholders from community sectors, health services, housing and homeless organisations, and a bunch of people.
Yeah, great. That's really fantastic.
Of course, other researchers. Yeah.
So it's been one of our principles to have consumer input from the beginning of the project and engage with them as experts. I think that's been a fantastic part of this work.
Yeah.
Okay.
And then, so we've had lots of different funding sources. This is just to acknowledge the various ways we've cobbled together money to do this work. Mostly you can see it's from philanthropic groups, a little bit from Victorian government, and the LGBTI Help Alliance has contributed particularly for the Guidelines project, which has been fantastic. And then we got a big health grant to do the Safe Housing Network pilot. Right, so a little bit about the findings from that first study. We've produced a project report. You can find that on our website. So, knowing that background literature and understanding around the structural indicators, we definitely found that structural discrimination, violence and harassment were all significant contributors to LGBT homelessness. But also there was this intersecting idea that there was individual vulnerability, which increased or exacerbated the risk of homelessness. And that often started with family rejection for young people at quite young ages sometimes, or family conflict around their sexual orientation or gender identity, and then flowed through to other issues around mental health, of course. So the 2 things are very interconnected. And, these are some of the risk factors that we identified from talking with LGBT people and services staff as well. So, the top one around lack of family acceptance was a really critical starting point for many people. Set them on the trajectory of homelessness, which often lasted for years. And then, the sort of intersecting mental health issues, including substance use, potentially as a coping mechanism, but that often exacerbated homelessness, social isolation. But then issues that were perhaps nothing to do with family acceptance, much more to do with societal discriminations, particularly in the private rental market, discrimination in education, in employment, particularly for people who didn't fit in. And so this is where the trans and gender diverse community were particularly disadvantaged, talking to us a lot about inability to access private rental, to access safe shared housing, and so on. And again, this lack of, particularly for people in transition, gender transition, not having the ID that they needed to access homelessness services or housing, having a long gap in rental history was a major disadvantage when trying to access the private system. So all of these things were discussed. And the idea of a cascade of repeated events that led to not just single episodes of homelessness, but repeated or long-term homelessness for this group. This is just one part of the stats. We did some secondary data analysis of Journeys Home, which is a big longitudinal study in Australia of people, I think, aged 16 to 58 or 60. So this was a stark statistic. Mean age of first homelessness for heterosexual and lesbian and gay were about the same, but for the bisexual young people was much younger. So that was intriguing. And then when we drilled down a bit, we could see that for the bi participants, they were more likely to have been in foster care or to have experienced childhood sexual abuse. So there was something in it for those young people around the family conflict and violence that was creating this issue around leaving home much earlier. And again, unfortunately, Journeys Home didn't ask about gender identity, so we had really limited understanding of that from that study. And then a few quotations around family conflict, which is such a significant driver. So, the first one from a trans woman, that sort of speaks to the idea of leaving home quite young because the family didn't want her to stay at home. The second one from the service provider, they had noted this issue around family conflict being at the heart of a lot of the homelessness for their young clients. So, that was very much on the agenda. This is another LGBT person we interviewed. I'll just let you read that. So, for them that was about living an authentic life, I suppose, and trying to retain their family connection, but then realising after a while that just wasn't possible for them.
Yeah.
And the issue of safety, that came up repeatedly from both the clients we interviewed and also the staff. That, this idea that LGBT people just can't find safe and secure housing for many reasons. Journeys Home also included a lot of mental health details, and we can see quite big differences, particularly again for the bi population in this group. Quite a huge difference in depression levels compared with the heterosexual and lesbian gay. Quite a big difference in anxiety for both the non-heterosexual groups. And then, intriguingly, and we can't understand this, why have the bis such a increased number of schizophrenic diagnoses? We don't know. And bipolar. So, we haven't really got good population stats on the low prevalence but high risk mental health issues. That obviously needs more research to understand that.
Yeah.
So I'll just let you read this quotation, which we've called the cascade of events.
Right.
So, you know, that idea, again, that one thing leads to another and that there's no escape, or that's how people depicted it. And then thinking about the rental market, you know, this was one of the perhaps newer things that came out of our research, both from clients and service providers. The very overt discrimination.
Mm.
And it's something that we're hoping to address in our future work around training up agents in rental offices.
Yeah, definitely.
Of this, yeah. And then an idea around shared housing and discrimination as well. Right, so, I mean, in summary, in terms of structural barriers, if we broaden it out again beyond that individual level, what we've identified is a sort of set of structural barriers that lead from one to the other. So for a start, there's no LGBT inclusive language in our homelessness and housing policies in Australia.
Mm-hmm.
So no discussion of LGBT or I populations as being vulnerable, unlike other subgroups that are identified in the policies. So that leads to a lack of data collection because there's no recognition that we need to know this population group specifically. And we'll talk a bit more about that in a minute. And, you know, if the homelessness services aren't collecting data about LGBT people, then they can't prove to the funding bodies that this is a highly vulnerable group.
Yeah, that's exactly right.
You know, and then you can't access training because nobody thinks it's an important area. Mm-hmm. There's no evidence to back that up. So, you know, these things all snowball. And then the policymakers say, well, we don't need to put it in policies because there's no evidence that there's any problem here. Well, that's because we're not collecting any data, you know. So the homelessness providers who we interviewed were saying, well, we've clearly seen an increase in LGBT presentations in our services, but we can't document that anywhere and we can't get support to understand that group better.
Mm-hmm.
So, you know, that's one major issue that arose from our issues with services. They knew the population was there, but they didn't know how to provide a targeted service for them. And the other issue that arose was, you know, is there a need for LGBT-specific homelessness services? Or is it better to create inclusive practice in the mainstream services? Mm-hmm. And that's always a tension. We can talk about that more in the questions perhaps, but, you know, that's an issue to think about. So we think they need some reform in all of these areas.
Yeah.
So just thinking about services, so, you know, from a service provider perspective, they feel like they're underprepared. From a client or prospective client perspective, we did have a few people saying that they didn't feel they would be able to go to homelessness services. They didn't feel they would be accepted. You know, this was a particular group of clients who actually were interviewed by The Age. Some asylum seekers who are now living in Melbourne who stated that they just didn't feel they could go to a service. They wouldn't be accepted there. And that's a particularly important gap. So we identified several service provision needs around the service provider understanding what the specific challenges are, not treating everyone equally, but actually understanding the differences and treating people according to their needs. The idea of safety that I mentioned already around accommodation. Language, using appropriate, respectful language, recognising when people are using a pronoun that might be different to their birth assigned gender. Addressing discrimination overtly, and then, as I said, really focusing in on the private rental market. Carl, did you want to add to this one, around the specific needs?
Sure. I guess there was some overlap in terms of what the interview participants felt were the gaps and the service providers, but there were some, I guess, differences as well. I think both perspectives identified that there was a need to sort of have a better grasp of language and terminology and respectful communication. And as Ruth mentioned earlier, just, safety is a key issue, not just in terms of helping people feel comfortable accessing services in the first place, but once they're in a service, and in terms of providing accommodation options that feel appropriate. There's just a whole range of barriers and gaps there, training gaps as well. There's significant gaps in knowledge sometimes in terms of really detailed medical, assistance that might be required for transgender diverse clients, or legal aspects of transitioning. So there's definitely a need for service providers to have more information across those areas. And generally, training sort of does need to be whole of organisation and really ongoing, and that's not just because there's so much to learn, but also because it's a really diverse community or communities where language, especially, like I said, is often changing, and needs aren't terribly well understood. So, ongoing training, whole of organisation is really critical.
Yeah, and that came up quite a lot, didn't it, Carl, around the high service turnover of staff?
Yeah.
And so, they might have done training 3 years ago, but half of the staff aren't the same anymore.
Yeah. It's tricky to keep track of those things across the sector. I mean, partly, especially now that there is more training happening, so it's a really important aspect of developing safe referral pathways is bringing that knowledge together, so we know, which services have done training and how much and when, and all of those details.
Yeah.
Thanks.
Okay. And we'll come back to that a little when we're talking about the guidelines development. We used a lot of this to understand what to put in the guideline. So yeah, as I said, the lack of consistent data collection is a real problem, and the services recognise this as well. One service we spoke to in Victoria they're the only service to date that has had an LGBT specific target group, and they say about a quarter of their clients are LGBT as a result. And one of the interviewees said this, which we feel is absolutely true, around data being a platform for advocacy. So they actually have a parallel data set. They collect their data for the SHIP database, and they then collect a separate data set which includes LGBTI, actually. The rapid increase, as I said. Some people felt that particularly bisexual and perhaps, as we said, people with intersex variations were invisible. So people don't tend to come out around being bi or intersex. That may be a problem in itself because their specific needs can't be met. So I'll just talk briefly about the transgender diverse inclusive model that we worked up at Launch Housing. So this was funded by Bendigo Bank, which is now called Community Sector Banking, a social investment grant. couple of years ago. I want to particularly acknowledge Anna Walk, who's the person on the left of that photo, who was the main person who ran with the project at Launch Housing. She was critical to the success of the project because she had a fairly high-level role, as in she could look across all of the areas of Launch Housing, and as Cal said, think about a whole of system approach to inclusive practice.
Mm.
So we established a community reference group. It's critical to the whole idea, you know, understanding what they felt a service should be providing to transgender diverse clients.
Mm-hmm.
Developed a model of care which came out of our project findings, and also was related to the Rainbow Tick standards but modified to fit both TGD specific issues and also homelessness specific issues. We got ethics approval so that we could write the project up carefully, and then chose 4 pilot sites at Launch Housing, all slightly different types of service provision. We got the managers in each site to complete an audit. Again, that was modified based on the Rainbow Tick standards audit, with 6 standards to focus on. And it was a simple process of reading each standard at dot point and deciding whether they'd already achieved it or whether they needed to do more. So that helped provide feedback to the organisation about what were the gaps. Did some training for staff at each of the 4 sites, and that was run by Transgender Victoria, who are experienced trainers in this area but hadn't done a huge amount in homelessness. And then a service-wide systems change led by Anna. So it was a really nice project. It went on for about a year. Anna developed a quality improvement plan, which had these components. As we said, an all of the systems approach, from organisational capacity and policies and culture, through training, consumer participation, looking at the front line and how accessible the service appeared for transgender diverse clients, looking at documentation and data systems, and then I guess developing cultural safety around imagery and staff awareness, and trying to look at appropriate accommodation options for inter-service referral. That's one of the posters they produced, which was displayed in the various pilot sites. So they worked quite hard on the data collection. They understood that this was a really important addition for their service. And so they added these, after much discussion with the reference group and within their own staff group, added these data sets to their, or data collection to their client service data. And, you know, particularly the list, it's always a moot point whether you have a male-female other, for example, in gender identity, or do you list a whole range of things and risk missing someone out? Mm. So, you know, that the decision at that point was to have a long list, but also have a prefer to self-describe at the bottom and prefer to not to say. They did that partly because they felt it was educational for staff to have a list, and also because they felt it was quite inclusive for clients to see themselves represented in the list.
Yeah, absolutely.
But, you know, it is a difficult point, and people could go either way on that, whether they have a long list like this or have an open text other box instead, or something in between. Likewise with sexual orientation. And if we did this again now, we'd probably have other things in the list because the terminology is changing so rapidly. This is another one of their posters they produced. Nice clear messaging around safety.
Mm-hmm.
So their key success, which is largely driven by Anna's reflections on the process, having this authorising environment. So, from the CEO down, this was regarded as an important project. But getting buy-in from staff as well was very important. Having an obvious perceived need from the beginning helped because the staff were sensitised and ready to go. Having the dedicated staff person that was driving change, who was a paid staff person, embedded in the system, was really important. We see quite often there might be a volunteer or a, 1 day a week external person really coming in to try and do rainbow tick accreditation preparation or LGBT inclusive practice. Makes it very difficult if they're not truly part of the system. The co-design element was really critical, and also the fact we were using evidence. Anna was quite forthcoming with the challenges though, and we noted some challenges too as the researchers. So as we said, the staff turnover is always a problem in homelessness for organisations. So the idea of needing repeated training regularly, data collection, the idea of getting this into the database that they can then report up. Fear of getting it wrong, the big one.
Yeah.
It can be quite constraining for staff. They'd rather be silent than put their foot in it at times. And she felt, she needed to do more about engaging the LGBTIQ staff members to get involved with the project and understand it and advocate for it. And then, the external challenges, which they couldn't do much about internally in launch housing, but we have an opportunity to do more. This one, the last dot point I just wanted to focus on around the binary nature of accommodation. The fact that the system has been set up from the beginning on the basis of you have female or you have male safe spaces. And, female-only accommodation or male-only accommodation is very problematic for trans and gender diverse clients and for some LGBT clients. So that's a difficult part of the system. Carl, I might throw to you to talk a bit about the Guidelines project, or a bit more about it. So, rising from all of that, we realised there needed to be fairly clear guidelines for the sector and to think about how this might apply across the whole of service.
Sure, thanks, Ruth. Yep, the need for guidelines was a message that we've probably been getting in all of the different projects we've done so far. So we've got together 2 quite large reference groups, as I mentioned before, including LGBTIQ reps, community representatives and experts from the mainstream housing and homelessness sectors, because we wanted this to be applicable to different kinds of homelessness services and housing support services as well, and hopefully eventually even with some applications for the private rental market. It's a big project, which we started last year, as Ruth mentioned, with funding from the National Health Alliance and Pride Foundation Australia. And we're hoping to complete the project around middle of this year, I think, mid to late this year. So the first part of this project was to really bring together some of the messages that we found in previous research in terms of what the gaps were, the service provision gaps, and put a draft together. And then we put that up to the LGBTIQ community experts reference group. That's really quite big. It has nearly 30 people on it, from memory.
Wow.
Yeah, a broad consultation process. Brought all of that feedback together, revised the draft, and then we've just recently put that together into an online survey format using the Delphi consensus model for the expert panel in housing and homelessness sectors. We've got most of their feedback so far, just waiting on a couple more people. And in terms of getting feedback from that group, it'll be more about seeing where the challenges might be in terms of implementation and how much agreement or disagreement there are around the various action points that we've got in there. And there's three main sections, but two for the services in that document. The first section's for service workers, and that's really broken down into the disclosure and confidentiality. So some of the issues there around disclosure, and then respectful communication. And I should say with this document, we're really striving to make it as intersectional as possible. It's a really important element. Cultural safety, whether it's in relation to accommodation, risks and barriers, different specific needs of particular groups, and how you can make a service really welcoming. And then there's quite a big section on discrimination and harassment, because that's been quite a concern for service providers in terms of how to work through those situations, what needs to be included in specific policies and procedures. And then another quite broad section on what specific support, referral and advocacy might look for LGBTIQ communities. So how to have a really person-centred framework, some example scripts, what kinds of supports are out there. And then the final section is really for service managers and sort of senior level, drills down into more detail about those organisational policies, different elements that need to be included and what changes might need to be considered in terms of procedures and facilities. And then broadening it out to, really importantly, consumer participation at all aspects of program design and thinking of accommodation, and then staff training. So lots of key points about what would need to be included there. And then the really tricky area as well of data capture and storage, which is a bit of an ongoing challenge because that's a national issue in a way. There's lots of great work happening in different states, but it's really something that also requires sort of top-down direction to make broad changes. So that's where we're at with that project. And yeah, we're sort of just waiting to bring those last few findings together from the panel, and then we'll revise that draft again and put it back to the community reference group, and go through that final round of consultation before it's completed. Was there anything?
Great.
Sorry, Ruth, was there anything else you wanted to add?
No, that's really comprehensive. Thanks, Cal. We're really excited about this because hopefully it will really help the sector eventually when we get them out there. Yeah. We'd like to include at the end some information packs as well for clients, people accessing services, just to make it as practical as possible. But also aware that there's going to be lots of gaps still, but we'll do the best that we can. Yeah, so these are just some examples of things we've put in there. Yeah. Confidentiality, how do you do it? Examples for managers. We've got codes of contact, for example, that other services have used, and they've given us permission to put them in. So it's really designed to be a working document that a service could take on and use some of the examples and adapt to their own needs. Right, and then finally, we're conducting a safe housing network pilot. Really, this is trying to assist services from an outside perspective. So, providing an LGBTIQ person who's at risk of homelessness with a peer support worker and a caseworker, and they can access support from those workers around finding appropriate housing, around accessing LGBTIQ community support, around accessing mental health or drug and alcohol education support. So, those workers have, with our support, collated a long list of LGBTIQ inclusive service referrals, and can adapt that to each person that appears in the network. So it's not actually providing housing, and I think we've had a bit of feedback around the name being a bit misleading. It's really a navigation, someone helping them navigate the housing and homelessness system to try and find the best possible housing for themselves.
Yeah, okay.
Yeah, so that's still underway, and we'll be doing that for the rest of the year really, and then evaluating whether it was useful for the clients and whether that might be something to take forward at different state levels around trying to find funding for it. All right, and then look, we've got only a few minutes left, but just a couple of, coming back to that idea of policy, you know, this is clearly a big issue for Australia around trying to develop LGBTIQ policy that's meaningful. You know, the current homelessness policy does list some subgroups that have a higher risk or more vulnerability, but not LGBTIQ at this point, despite all of this increasing evidence. The STEP program is one example of inclusion. You're probably aware of this program in New South Wales. It's a transition engagement program trying to help people, a little bit like Safe Housing Network in a way, trying to help provide wraparound services to people, as well as providing rapid housing or housing first approach.
Mm-hmm.
And the evaluation, we've been approached by David Dunt, who's a health services evaluator in Melbourne, and he's won the tender to evaluate that project, and will be specifically looking at the LGBTIQ people within that program. So that'll be really good to think about what are the differences that might apply to that group. So, you know, increasing amounts of evidence that we can take up to government and say we need more focus here.
Mm-hmm.
So, you know, these are some of the things we think need to be reforms, as we've already discussed.
Yeah.
It's pretty clear.
Yeah.
Preaching converted here. All right, so that's all the slides. I guess if we've got any time, we could answer any questions